Now, I've been teaching this all over the country to medical professionals about the importance of stress, to corporations, and community wellness programs, to the public. And I've had so many people say to me, this makes such sense. You know, as soon as New Year's is over, I'm getting with this program. Oh, I can't do it now. I got that project at work. We've got my husband's family's coming to town. I actually had one woman say to me, I'm a little too stressed right now for stress management. So we tend to procrastinate. And I can remember being in that camp. But that changed for me in 1977 when I was 32 years old and I went through bypass surgery. I thought I'd been doing the right thing. I grew up in an era where they said, eat a lot of red meat, drink a lot of whole milk for strong bones and healthy teeth, so I did. I was smart enough not to smoke, but I lived in Connecticut where the doors and the windows were closed about 7 months out of the year. I had 2 parents that smoked. I don't blame them, they didn't know, but I paid a terrible price for secondary smoke. I was physically active with 2 sports in high school, 2 sports in college, but in those days you came out and you stopped. You played a little social golf, a little social tennis, but no one was talking about aerobic exercise. And I was under stress. I had my own business, but everywhere I looked, people were under stress. So I didn't think anything was out of whack until one day I was playing tennis and I got a little pulling sensation in the middle of my chest. Can't be anything. Went back the next day, got a little pulling sensation in the middle of my chest. Can't be anything. Went back the next day, the next day, the next day. The upshot was I played tennis for 30 consecutive days. I never missed a day. And on the 30th, my little pulling sensation had turned into a kind of a white-hot pain and I couldn't catch my breath. So I went to see my family physician. I had seen him 4 months earlier for a complete physical that had been perfect. So I did not even make an appointment. I walked in the door and promptly announced, I have bronchitis. I'm not breathing real well when I'm playing tennis. Take a look at my lungs. He was a nice guy and a friend. He took a look at my lungs. He said, Joe, there's nothing wrong with your lungs, but as long as you're in my office, let's do an electrocardiogram. I said, sure. I had it done 4 months ago. It was perfect. So I hopped up on the table, and I'll never forget his words to me. He said, gee, something's wrong with my machine. I'm getting a bad reading. Shall we do this again? I said, by all means. So I climbed back on the machine. He kicked it once or twice, flipped the switch. He said, Joe, there's nothing wrong with my machine. There's something wrong with you. You have a heart problem. I said, doctor, with all due respect, you're crazy as a loon. I'm 32 years old. I play tennis every day of my life. 4 months ago, I was in this very room, sitting on this very table. You said everything was perfect. You can't be serious. This can't be a serious situation. He said, let me tell you how serious I think it is. I'm closing my practice for the rest of the day. I'm driving you to see a cardiologist because I don't want you behind the wheel of a car. Well, that got my attention, and we went to the cardiologist. He did an external exam. We immediately crossed the street into the hospital. He did an internal exam. 2 days later, I was in bypass surgery for a 95% blockage of the left main coronary artery. My children were 6 and 4. I hadn't been married to my wife 10 years at that point. My new house was 1 year old. My new business was 3 years old. We did not know what hit us. And it actually got worse because in 1977, no one knew very much about cholesterol. I wrote the first book in this country on diet and cholesterol, a book called Don't Eat Your Heart Out. It came out in 1982. It was a huge bestseller. But in 77, if you had asked 10 physicians about cholesterol, you might have gotten 10 slightly different answers. But I was lucky, I thought, because the University of Washington Hospital had just opened up a major lipid clinic. And it even invited in a very famous doctor from Washington, D.C. to come and run the clinic. So I said to my wife, this is it, I'm going up, I'm going to run through the test, we're going to sit down with this famous doctor, we're going to get it all straightened out, life will go on. So I went up, went through the test, and I sat down with a physician and said, cholesterol's a problem for me, isn't it? He said, oh yeah, your numbers are just way out of sight. I said, well, should I make lifestyle changes? Should I change my diet? Should I start an exercise program? Should I not be around smoke? Should I manage my stress? He looked me right in the eye and he said, don't bother. He said, you're 32 years old, you have aggressive coronary disease. Frankly, I doubt you live to be 40. He said, if you think you're going to see those children in the waiting room graduate from high school, it's not going to happen. He said, you can go home and do anything you want to do. He said, I'm not a believer in lifestyle changes. He said, I'm a believer in genetics, and I think yours are pretty bad. But you go home, you do whatever you want to do with diet and exercise and stress. He said, but remember one thing, this is not going to end well for you. And that was the message I took home. And I didn't know what to do. I looked at the refrigerator, do you eat this, do you not eat that? You know, those were the days, we weren't far removed from the days when they put heart patients to bed. You know, do you exercise, do you not? So I moped around for about 2 weeks, and finally my wife had had enough, and she yanked on my chain and she said, look, let's get something straight. You cannot change the cards that you were dealt. You're 32, you have aggressive coronary disease. We can't change that. But we can change the way that you play those cards. And I don't care what that advice or lack of advice is. We are going to make lifestyle changes. We're going to eat better, we're going to exercise, we're going to manage our stress, we're going to stay away from smoke, to see if we can't even up the odds. And I'm pleased to tell you that that's what's happened. Last July I celebrated my 34th anniversary of bypass surgery. I am well past the age of 40. I have a Medicare card to prove it. The Heart Association thinks I may be the longest lived coronary bypass survivor in the country, if not the longest, certainly one of the longest. I've been married to my wife now 44 years, been married to have seen my kids graduate from high school and college and graduate school and law school, and we're now even on the new generation. That's my grandson Joe, and I put him up there not just because he's a cute kid, but I put him up there because it reminds me that at one point in my life I never thought I'd hold a grandchild. So I am beholden to healthy habits. Healthy lifestyle changes have been very, very good for me. I also put him up there because I don't want you to think that what I've been talking about has simply been science and numbers and data. It's about people. It's about how you will choose to live your life, how your family will choose to live your life, how your Round Rock family will choose to live their lives. Okay? I used to be a type A plus personality, and now I'm a little bit less than that. I'd love to say I'm a B, but I'm probably an A minus or a B plus. But I'm pretty good through most of the year, except on one day, the anniversary of my bypass, I get a little agitated. And I have done two things for 34 years religiously. The first is I've hiked up to the 9,000-foot level on Mount Rainier. I've done that every year for 34 years. And the second thing is I send that doctor a card. I have never had a response. So, the message to you today, for yourselves, for your employees, is a simple one. Life is not a dress rehearsal. With the possible exception of Shirley MacLaine, the rest of us get to go through one time. On the one time through, we will make choices, and stress management is one of them, that will either put us on the road to health or put us on the road to disaster. So I implore us all to make the right choices, because I've learned anything in the last 34 years, it's this. If you will not take the time for your health today, I can promise you, I can guarantee you, you're going to have to make the time for your illness tomorrow. Thank you so much for having me, and thanks for listening.